Hi, and welcome to Healthcare Matters, where the medical and legal communities come together to discuss healthcare matters. Today's guest is John Degnan. John's a shareholder with BRIGGS MORGAN in Minneapolis, Minnesota, where he specializes in business litigation, including medical professional liability. John has represented clients with electronic medical record issues and has experience with HIPAA and the HITECH Act. Welcome to Healthcare Matters, John.
Thank you. I'm happy to be here.
How has the move from paper medical records to electronic medical records affected best practices for entering data into a patient's chart? And what guidance would you give physicians so that they're using best practices when entering data into their patient's medical records?
Well, overall, I think it's a very positive move because it leads to a lot more continuity even across different medical providers. However, there's some adjustments that I think have to be made by physicians. For example, the most important thing is to make sure that the drop-downs or checklists that are used are absolutely accurate for that individual patient. Close doesn't count, obviously, in charting. And so if indeed some of the drop-downs don't exactly capture what the situation is for that physician, it's very important to be able to free text or explain it so that at the time it's accurately recorded so that later on it'll help not only in the care for patients but in the event of any claim or question about the care. The other is to be careful about corrections being made. It should be done like it used to be, that is, making it clear that there are tracks in the snow, because there's some providers that allow for deletions, but some of them then later on show up only as deletions and doesn't show what's deleted, so it looks like some record is destroyed. So it's very important to leave what I call the tracks in the snow.
Okay, so even a benign deletion could be considered to be nefarious.
Absolutely. We had one case in which it was good care, defensible case, but there were about 10 items where there were deletions of just simple words, but the way that that provider had it set up, all it showed was deletion. And so it looked like destroyed evidence. There was an adverse inference called for. In other words, that it must have been bad, ladies and gentlemen of the jury, or they wouldn't have destroyed it. It led to a case that should have been defended but couldn't be, and the cost for it was about 2 to 3 times what the value was, just because of the prejudicial nature of that.
Well, I'd like to thank John Degnan for coming on our show today. It's been a pleasure, and I hope you'll come back soon.
Well, I hope I'm invited back. I enjoyed it. Thank you very much.
Absolutely. Thank you. A recent RAND Corp American Medical Society study called for a complete design overhaul of electronic medical records to improve their usability. If you had the opportunity to advise a EMR industry on a redesign of its products, what changes would most benefit the defensibility of a medical malpractice claim?